This breakout group is on community-based violence. And this group, while it's small, is the one that deals with some of the most complex issues, the broad issues that affect all populations, not just women, not just children, not just elderly, not rich, not poor, but the broadest context. Community-based violence encompasses a great deal. This is where we have an opportunity to talk about what affects cities, towns, villages at the grassroots level. Gang violence, youth violence, interpersonal violence, lethality, firearms, homicide, so many different things. We know that in our prior conversation, a lot of people in the other groups will focus on very specific populations. We get to focus on community as a greater whole. We have three core questions. The broadest and really the most significant from the point of view of our purpose is to talk about how community-based violence relates to the Sustainable Development Goals and vice versa. Then as two subsets based on the members of the forum talking yesterday and building on some previous workshops, how does mental health fit into this context of the Sustainable Development Goals, and what we've talked about in regard to resiliency, individual and community resiliency, and how do they relate. But the main thing is just to get us started, to ask you to talk some about your thoughts relevant to community-based violence. What are the pressing issues that you see? What concerns you the most? And this is a beautiful thing that we can do in this workshop. Talk about this not just globally, but get it right down to local and neighborhood levels, which is really important. If we're going to deal with community-based violence, we have to get the discussion down to boots on the ground efforts at the most local of levels. And again, however you want to define that. A neighborhood, a town, a village, a tribe. We have to get beyond the lofty discussion. Thank you. Two logistical points before we open up the floor to whatever you want to talk about to get us going. We need a note taker, and we need someone from the team that is willing to present what we discuss, what we come up with. So do I have a volunteer for note taker? Should I aggress? Okay, we have a great note taker. We have actually note cards. Oh, thanks, Louise. I was going to do it. And who's willing to present? I shouldn't do it. Thanks, kiddo. I appreciate it very much. That's great. So let me open the floor right out of the gate without posing any specific questions or just open up your thoughts on community-based violence and putting it into context. I'll get you started with one idea. Jim and I talked about it. Well, while I'm in academia now, I come from a law enforcement background. I'm a former police officer. And as important as the Sustainable Development Goals are, I mentioned this to Molly very quickly, I suspect that very few, if any, chiefs of police or sheriffs in the United States have ever heard of them. Their mayors and governors may have, but it's not making their way down. We don't connect local prevention and enforcement efforts relevant to violence to a grander scheme. That's one issue. Another issue is that politically, the way we're charged to deal with violence as law enforcement executives, and I was a bureau commander in a large police department at one point, what is now a large police department, is through quick hit statistics and absence of negatives. That's how our success is measured. Good stats and absence of negatives. We don't look much beyond that because that's how we're judged politically. So my point is, just looking at one sector, the law enforcement community, there's not much connection to a grander scheme in violence prevention. I don't know how it is for the other sectors. The floor is yours.
Sure. I think
And please introduce yourself.
Sure. I'm Thomas Ept from the Harvard Kennedy School. First of all, what department?
Howard County,
Very
Maryland.
good. I guess I'll respond because to this issue that you've raised, because I was interested in asking the panelists about it in the previous panel, which is what is the role for law enforcement in an overall public health approach, and how are they integrated into this approach? And so I'd love people's thoughts on that. And then just stepping back more broadly to the just thoughts about community violence. I think the most important thing for me is that we talk about community violence and talk about its importance, particularly in terms of by my back of the envelope calculations. Community violence likely accounts for more homicides than any other form of violence. More homicides than family violence, school violence, more homicides than organized violence from organized crime, and certainly from state-sponsored conflict. And why don't people talk more about that? And why can we not get more public attention on the sort of mundane, everyday, yet horrific sort of slaughter that happens in communities around the world?
Tom, could you, before you give up the mic, talk a little bit about how you think of community violence, how you define it, based on what you just said?
Sure. So I'll talk more about this tomorrow. My presentation will be devoted to this, but I don't view any one form of violence as a discrete category. I propose viewing violence along a continuum. Community violence I see as in the middle of that continuum between highly disorganized violence on the one hand and highly organized violence on the other. It's a hybrid. And there are, roughly sort of 6 categories along which I would sort of define types of violence. And so within those, community violence to me is violence that occurs in public. It doesn't occur in the home. It doesn't occur in schools. It's violence that occurs between individuals and small, loosely organized groups. If the groups are highly organized, it's a different form of violence. It's violence that can be quite serious, meaning in terms of lethality, but it doesn't. But it isn't always lethal, as as opposed to bullying in schools, which is not lethal, generally speaking. It's generally impulsive, meaning that it's done it's from a psychological term. It's expressive violence. It's not instrumental violence done for commercial or instrumental gain, and it's generally not very planned out. It's street crime. It's disputes between neighbors and small disorganized gangs. And so that's sort of how I would sort of place it on a spectrum of other forms of violence.
Anybody else's thoughts?
Something about the boots on the ground, Elizabeth Ward, EPA Jamaica, that I was very interested when I was in the US before, and we went to Congress after one of the meetings, and it was that the police chiefs were there around a message was prevent crime, invest in kids, and those police chiefs, US police chiefs, were clearly identifying what we understand and know, that intervening early, protecting your children in communities are going to give you the benefits. And they were changing their police strategies to address this issue. And one of the things I'd be interested in knowing is this the kind of approach, Shelley, that we need at different levels to get some of this key messaging out there that can make the difference? I know what happens in high violence countries where the police are under a lot of pressure, as you say, to provide good statistics and to reduce the numbers. Sometimes the policing ignores the community side of it. They just focus on what we would almost call hard policing to try and change the stats. And getting that shift is very difficult. And how do we get that process to occur is challenging.
Put that out to everybody in the room. Go ahead, Tom.
I'd just say that I love fight crime, invest in kids. When I was at the Justice Department, they came to us frequently, and I think that often law enforcement, being an unconventional messenger, can be a strong advocate for prevention. But I'd also like to hear from public health the converse. When does public health think that law enforcement is needed and plays a role?
So this is Elena Teacher-Rooney. I'm from USAID and the Central American Regional Security Initiative. One of the things that I think is important when we talk about community violence is not necessarily categorizing that it has to be a particular type of violence or a particular type of crime, but that we think about how it's really changing individuals' behavior within that community. So for me, that's very important when we talk about how does collective violence fit into the context of the Sustainable Development Goals. When you are living in a community that is a high violent or high risk community, you're changing your behaviors in terms of whether or not you give your kids educational opportunities, if it's safe for them to go to school, you perceive safety for them to be either on their way to school or in the building itself. I think it changes your sort of economic goals as a household, what types of work you'll accept or what types of work you're able to access, whether it's inside or outside of the home. In some of the work I've worked in, specifically in Central America for many years, but speaking to people about whether they hide their employment from their neighbors because they're afraid that their neighbors will turn them into local gangs because that way that they get off of paying their impuesto de guerra because it's being taken from the neighbor instead. So looking at that kind of level of trust between individuals. So I think it's not necessarily saying, oh, is it a fist fight between neighbors, or is it this, or is it that? It's how does the behavior change as a result of being in this very high risk area? And I think that does get into the thing of, okay, so what makes a difference in an individual's perception of how they can act in their community? Is it that they do turn to law enforcement in order to settle disputes, or that they don't? Who do they turn to for justice? If law enforcement isn't seen as a credible agent within that community, who are credible agents that we can approach violence through? And I think that that's where we're all kind of coming together in a convergence of saying we can do parenting classes, we can do a public health approach, we can use health workers as mitigators of violence, but how can we do that, and how can we sort of look at the individual not just as part of a family unit or as part of a school unit, but as part of this broader context within which they need to act and live every day? So, not an answer, but that's, I think, important to addressing the question.
Oh, it's great. Please.
I'm Peggy Murray from the National Institute on Alcohol Abuse and Alcoholism. And I just wanted to kind of get into the discussion, the fact that alcohol outlet density is a strong predictor of community violence, very strong. In fact, sometimes in some neighborhoods we've seen it at over 50%. So policies that limit the number of alcohol sales establishments that can be allowed in a certain area could be a really strong preventative tool. You're fighting against the fact that those outlets bring in tax revenue to certain areas, but I think it's important to continually make the case that reducing the density, you reduce violence. The goal on health, but also I think the goal on cities, I think it was number 11, where you're talking about safe cities and safe neighborhoods.
I think it's important in regard to the three folks who've already spoken up to, if you can, just give a little context as to whether what you're talking about is U.S. centered, specific community centered, or based on your knowledge and experience is something you see globally. That would help.
If Rodrigo were in the room, he'd say
I
it
agree.
certainly matters globally. I'm speaking on data from studies we fund in the United States, but I would think it, at least from hearing to people,
Yeah, there's good evidence, I think, globally. In Latin America, there's been some good studies done in that area.
And one thing, if I may, just to come back to a term that's already been used a couple of times where we talked about the police or law enforcement, is that is dramatically different from nation to nation, even in core structure. As many of you know, here in the United States, it's probably among the largest, most fragmented professions in the nation. Tom, help me with this, something along the lines of 18,000 police departments, give or take, and each one in its own way is siloed politically. And we have to rely on professional associations to help advance the entire field and bring it into the fold in some of the broader dialogues. There is one of the things that most people don't know in regard to law enforcement and prevention of violence is that there is no one in charge of law enforcement in the United States, as there is in some nations. We don't have a point at the top of the pyramid within the law enforcement structure. Tom, your thoughts would be helpful on this, but the Attorney General doesn't set local law enforcement policy, or the Attorney General doesn't talk about local law enforcement staffing. The Justice Department has influence, but there's no one office you can go to. Tom, again, I bow to your experience on this.
Well, from my perch at the Office of Justice Programs, where I was Chief of Staff for the first 4 years of this administration, the Attorney General is the most senior law enforcement official, but you're absolutely right that he has no direct control over all of these different state, local, and tribal agencies. Much of what we did at OJP, and I think OJP continues to do, is to think about how to be strategic and use the influence of the purse of your funding dollars, influence of your convening power, influence of your messaging, and that's as much an art as a science, but it's very related to what we're trying to do here. We have no direct control over any of these countries or any of their agencies, so it's a similar environment.
And just to echo your comment about who's approachable, if Arturo was here, I think he was a minute ago, he would talk about this. In some nations, some parts of Mexico, the police are perceived as the villain, not the go-to for help.
Well, and I think that also depends. If you look at the police structure in Latin America specifically, you generally have municipal police, state police, and then the national police, in addition to any paramilitary forces that might be also acting in the same area. So that's, in Mexico, you saw a lot of that, especially in the fight against the drug war. But it's something that also happens in Honduras. It also happens in El Salvador. And frequently in the law enforcement agencies where there is much more of a direct line of control, you have higher frequency of human rights abuses. So again, they're not necessarily perceived as a protective factor. So I think you're running against two separate issues. One is that there's no one that you can say, hey, you tell the police what to do and they'll do it right. There you go. It's there are a preponderance of agents in that area, but also that there's a longstanding history of human rights violations from the police that needs to be rectified and is ongoing, especially with a focus on sort of control and, I forget how to say the name, but the mano duro policing. There has been such a focus on that in Latin America, and it has had very negative impacts on the relationship between citizens and the police, that the law enforcement in that most visible form is not necessarily the easiest entryway into a community where there really hasn't been a relationship in the past.
So in those situations, how does the community within its own structure prevent violence? Who emerges as the lead? Who pulls the community together if the police are seen as the outsiders, as the negative factor?
Shelley, Colleen Scanlon, CHI. And I guess, when we think about community violence and, where police fit in, I don't necessarily, from the work that we do in communities, which is U.S.-based, see the police as the conveners of community coalitions, community partnerships to address issues of violence that are of concern to the community. I do see the police, justice departments, and others as members of a partnership that brings collective thinking and action together to address issues of violence in that community. But I don't necessarily see them the lead in that, but as a partner. And that it really needs to be the community that becomes empowered to consider the levels and the nature of violence in their midst, and then really be a part of the solution as compared to other organized bodies such as police or other agencies. If there's not in our experience, community engagement in the fix and in the recognition of the problem, it's really hard to go about change and positive action.
So how do you motivate that in a community that may be driven by fear due to violence?
Certainly, others can reach in, get in. I don't know if there's one fix or one how-to, but beginning to, first of all, many communities already have activities or actions, collective actions on focused areas of concern in the community, and putting violence on that agenda most times feels like a natural, feels congruent to the community experience because they're living it. But it's a long-term process to build the kinds of partnerships and coalitions in a community that can then work together to problem solve. But it's continuing to invite people to the table to convene. I think as a healthcare provider organization, we have a place at the table. So does social service, so does law enforcement, so does schools, church entities, civic organizations. It's just trying to gather and convene. And violence frequently, if you do surveying, community surveying of needs and assets, violence and safety frequently emerges to the top of the list.
Well, I'd like to flip the coin just a little bit. Multi-sided coin. Oh, I'm sorry, I didn't see.
It's okay. Shannon Cosgrove with Cure Violence. So a few points here, but also want to mention that we're leading a movement towards violence as a health issue here in the U.S. specifically, and hopefully go global eventually. So definitely want to build off of quite a few points that were brought up. But obviously, as many of you know, Cure Violence is based off of trusted community workers, community health workers, if you will, who are ingrained in the community and who also understand the context in which people are living in and how violence is perpetuated, and oftentimes by the police itself. And so how those individuals can serve as the conduit for raising the issue of violence, not only to interrupt the actual circumstance of violence or that particular incident, but also to get it to a level where the entire community can be engaged and be involved. And to your point, Colleen, really thinking about how everyone is involved and has to play a critical piece in this, how it can't just be law enforcement, right? And so our biggest stance is that the health departments, hospitals, et cetera, have not played a big enough role, yet are dealing with many of the outcomes that we see as it results to violence. So I think, thinking about, when we talk about media, when we talk about who we go to, it is often the police, right? But the police are being held responsible for it, yet we all do own a piece of this puzzle. So how do we get health departments? How do we get hospitals? How do we get those key officials to be spokespeople and to be talking about violence as a health issue? And it's something that is preventable and is treatable as well. One of the examples that Molly gave before in terms of Burma, the messaging piece, like I would love to see how that potentially could be, expanded upon to talk about how to train our media experts so that we can really, again, reframe this so it's not bad people, bad places. Instead, it's, oftentimes individuals that are subjected to violence early on in life and continuously through systems, and how, again, we can reframe this so that it ends up being a preventable issue. So I think one aspect of the SDGs that we can really go on here is moving away from this data piece into this people piece, right? And when Molly talked about those 5 Ps, because again, when Thomas brought up how there'll be small instances of violence and it evokes such fear and it evokes such a reaction and a logical one, right? Like we should all be responding to Columbine and Sandy Hook with responses that, we have bike rides and we have nonprofits that emerge and we have all these instances where people are rising up in support. But you don't see that in Baltimore, where we lose just as many people in a weekend, and so that's where it gets into this number versus people, like the individual. And so how do we start changing that dynamic so that we can ultimately care about each individual? And to answer your question about like where does this come from, and I think the equity piece that Jim brought up is big here, right? Like, so we really need to talk about how we're valuing life and how our systems are valuing life in order to get to those root causes of why things are manifesting the way they are.
Okay, so you asked the question, how do we affect the change? I want you to answer it. And in this context, and this is very important to the comments we've heard before, and I don't mean to flip the negative side of the coin, but given the amount of money, given the history, the evidence that we have on everything from street gangs to gun violence to domestic violence over decades, why are we still where we are?
Can I suggest that one of the issues is that people shoot between the projects? In other words, we really don't spend much time getting that community ownership of peace and the value of peace. And that we need to work as a group, as Khalid said, together to see how we can find common areas of, who takes the lead, is often not the police, and often it has to be guided by the public policy, the culture of the country, the politics of the country as to the approaches. But the community as a whole, somehow all components of it, including the people involved in violence, have to take ownership of that piece. And then I think there's an important concept that we've seen is that because of the levels of violence, there's a lot of trauma. So there is need for, whether you want to call it trauma care, grief counseling, and this has to be very widespread, and this has to be very broad-based. As Jim was saying, you start at the bottom. What can be done for everybody in the community to reduce that level of trauma, that level of fear, so that they can be more active participants? And then you move on to more engagement, because if once you do have that engagement, what's in it for the people? What does peace mean? Will that mean I get to send my kids to school safely? Will it mean that I will get a job? Will it mean that the police won't pick me up for a marijuana spliff and lock me up for weeks? Will I be put in jail for a tattoo? Yeah, you understand? Will some of these things change? And it's through the discussions that you identify that. And then I think the longer term thing is, will real development, which is one of the goals, economic development, be put into the community? I remember meeting an American philanthropist who actually had come to the Caribbean and used to do a lot of restorative work of hospitals and clinics and all kind of things. And he was a banker, and he said, I'm doing some more work in the US to turn around the crime in my neighborhood. And he said, you know what I did? I built a big supermarket. And he said he put that supermarket in the middle of an urban US slum. And he said that changed the whole profile of the community. Understand? And I went to a supermarket recently near our hotel. It was called Giant. And what was very pleasing to me to see was that, first of all, I saw people buying good food for a good price. Also, the SES of those persons looked very, very mixed to me. In other words, and the people working, you could see large numbers of people employed by this large investment in a neighborhood. And sometimes I think they did it in Korea where they had a whole urban slum. And what they did was they took out the slum and they put in a highway with alternative housing. They've done it in South Africa where some of the German projects in South Africa have turned the whole community into peaceful walkways and parks surrounded by housing that look down on the parks to make sure the safety is involved. But it's not necessarily just building pretty buildings, but it's meeting the needs of the community and ensuring that there's going to be wholesale buy-in of the different sectors, but the economic viability and stability of it is there so that people see the benefits of what they're doing. And police are involved, but police are not necessarily the forerunners of that whole movement.
Thank you. Other comments? You described a couple of interesting approaches, but, oh, I'm sorry. Bonnie, were you going to say something? Oh, sorry.
Here. Okay, so my name's Bonnie Olson, and I'm from University of Southern California, and I work primarily in elder abuse, and truly just on a domestic level. What we know about elder abuse is that it happens much more frequently when elders are isolated and not visible in varieties of ways in their community. And certainly we know that when communities are more violent, people become more isolated, and the more vulnerable members of the community become even more isolated. So I have to think that elder abuse occurs at much higher rates in more violent neighborhoods. From the work that we've done through the National Center on Elder Abuse, in trying to re-engage elders who are isolated into their communities. The communities that have a sense of real buy-in and a sense of community that's small, that's more neighborhood-like, where folks can go out and walk on the street and not feel fear. Kids can go to school where they're walkable, where there's grocery stores to buy something fresh to eat and not just a liquor store around the corner. That prevents that sort of isolation and vulnerability that we'll see. In my experience, it's also those communities where the police don't play a role as sort of coming in when violent acts occur solely, but are more engaged with people, and there's less fear of engaging the police when there is a dispute or a conflict. So I think it really, for me, the concept that I see related to sort of violent neighborhoods, violent communities, really has to do with isolation, that people pull apart and become isolated, and they lose that sense of community where everyone's life is valued, even the more vulnerable, the children and the elders and people of diversity. So that's my thoughts.
I think that theme of isolation is really important, both in terms of understanding the problem and mapping the solution. Violence drives people apart from one another, but it also, separates people politically in terms of how to respond to it. And so in some ways, community violence, and one of the reasons that I'm most interested in community violence is because of all the various forms of violence, it may require arguably the broadest, most diverse coalition. You have to have hospitals, schools, law enforcement, business, others, all at the table. And so that sense of isolation happens not just for the the victims in the community, but also amongst ourselves. And I think that one of the sort of challenges with community violence is to really think about how all of those different parts sort of affirm one another and work well. One of the main issues, though, I've encountered with community violence is once you sort of say we need a comprehensive approach, we need everyone at the table, you immediately run into two issues. You run into an issue of implementation, and you run into an issue of scalability. And so in terms of implementation, I think the evidence that I've reviewed is that comprehensive efforts, if they are truly comprehensive, meaning they're trying to get every single actor, who has any equity in the problem together, generally are not effective because they collapse under their own weight. There's just simply not the political capital to pull that many people together for a sustained amount of time and work them all in the direction. Absent, extraordinary leadership from, a mayor like Rodrigo Guerrero or, Sergio Fajardo or, the recent mayor of Los Angeles, Villanuevas, or, pulling people together. But that's often isolated to a sort of charismatic leader. And what appears to be more effective are balanced approaches, but that are actually much more use smaller coalitions, and only the coalitions that are really only the partners who are really directly contributing to the issue. Not because the others aren't important, but simply because the ability to coordinate is a finite resource like anything else. And then the sort of issue of scalability, which is if you're addressing the root causes, if you're going deep, if you're talking about, providing resources to neighborhoods and to the people in those neighborhoods, you very quickly sort of, the answer becomes, well, we need a massive restructuring of this society. In terms of, being more inclusive and more equitable and those things. And we all want those things. But the answer to violence reduction can't be we do everything else first and then we work on violence. And I think this is something that Cure Violence understands. And so I think that the evidence that I've seen is that serious community violence, meaning violence that is, likely to send someone to the hospital, seriously injured or dead, is highly concentrated. It's not evenly distributed in neighborhoods. It's not evenly distributed among the population, and it's not even evenly distributed around behavior. And so you can make a big difference on violence by focusing on the small number of people, places, and behaviors that account for the majority of violence. And that needs a balanced approach, but for me, this is sort of the dance of collective violence, which is how do you maintain a holistic approach while being very focused, because the two seem in contradiction with one another.
Would you answer that question? How do you?
How do you do it?
Yeah, how do you, in your opinion, and we'll get others to respond to this too, balance that holistic approach and the narrow, more isolated approach?
So, I think you've got to begin with having the right political leadership in charge, and that political leadership needs to sort of say, as many people here have said, law enforcement is a part of the solution, but it's only one part of the solution. And then that convening power has to bring together the various key actors, not every actor, but the key actors to address it. And then I think that there has to be a commitment to analysis. You shouldn't work on community violence, in my view, and I've advised mayors and other high-level officials on this. If you don't know who your hot spots, your hot people, and your key behaviors are, you're not ready to get to work, because everything you will do will be plagued by inefficiency. And then you need to assemble the sort of coalition around who are the people who can engage those high-risk people and their families and their communities. What are the services that are needed not in the neighborhood broadly, but in those hot spots? If you're thinking about where to place that grocery store. And then the behaviors. And for me, there's three, carrying a weapon, belonging to some type of group that has a propensity for violence, and being drunk.
Fortunately, that's true. To answer the question about how to be focused and at the same time make sure it's a holistic approach, it's important that people within the community who are advocates for preventing violence be credible, be up to date on the research and the local situation as well as research in general, and be seen as the go-to person for the policymaker, because policymakers can get information from a lot of different sources. And I have often seen community organizers not be the source of good, solid information, not just the hyperbole that helps their cause, but knowing what's really going on so that the policymaker starts to respect you and feel like this is where I can go to get the information I need on what my hotspots are, what might be needed in the community. Because this person has always been credible, has always told me the truth, and is really aware of what is going on in the community. So I think that community leaders have a really important role there. And if it's not there, then you're really setting yourself back.
Yeah, and to the, continuing the same conversation as we were talking about, I do think, some of the places, I think you're right that if you have a coalition that is too big and too broad, it can kind of collapse under its own weight. Though some of our coalition work locally, we needed to start out big because everybody wanted to be at the table and kind of participate. But you almost found over time that there was a natural weaning of it. And, people kind of move away who can't sustain themselves even in the work. And then also in doing kind of an assessment of the communities and what the issues are and some of the data around some of the problems related to violence using state statistics, community statistics, the hotspot mapping, law enforcement statistics. Once it began to get more focus, then the voices that wanted to be engaged in that naturally emerged. I think that one of the biggest challenges, and something that we've talked about in the forum a lot, and Shelley, you bring it up a lot, is translating, though, meaningful research, evidence-based or evidence-informed practices that are really impactful in mitigating or reducing community violence to the community level. Because people want actionable activities and processes to be a part of. And so big, complex, multi-layered interventions are hard for communities when they want to get in and just do something. And trying to translate all that we know to things that are meaningful, effective, and actionable at the community level is probably one of our biggest challenges.
Please.
Back to the how-to, if you will, and to Thomas's point about data and hotspot analysis. I just find it interesting that we've looked at health departments, again, just U.S.-based, but I would assume that this would translate nationally as well. And several health departments in the most violent cities across the U.S. had said we see this as an issue. We just don't have the capacity to do this. And it's not listed in their current community health needs assessment, and it's not, the data isn't being collected. So even, having access to that data and then doing something about it is a problem, which is also the same for hospitals within the US. And if we're not collecting that data, that's a problem. If we're collecting it and saying it's criminal justice issue alone, then that's a problem. If we note that it's, in our top 5 issues within our community, then ideally that gets linked to community benefit dollars and so on and so forth. And then there has to be investments that are coming from the community. So I think one of the pieces is like requiring that data be included, and then also map it to where these institutions can have an effect, because many of them, even though they see it as an issue, may just automatically divert or say that, it's criminal justice. And to your point about, we've spent so much money in this arena, I think oftentimes, again, at least in the US, when there's violence, what happens, the money it goes to the police more, right? So you have violence, and then you increase the police within that area, and then the funding continues towards the criminal justice system. And again, criminal justice has a place in this, but there are other spaces that can intervene and actually be effective. And so I think, if public health, if health in general, and the other sectors, if we built up based on what is working nationally and internationally, and then funded those at a way that it's not year-to-year grants, right? It's actually something that's sustainable, and it's ingrained in our communities and focused in the communities of highest need, then I think we would see substantial changes. But instead, we're focused on, the new sites, or the most emerging sites. You could go in for a year or two, and then the funding goes away, and you have to go to a new site, and you're just chasing instead of actually having something that becomes institutionalized, and offers that complementary role, if you will, to the police and to criminal justice system as health and other sectors within the community.
Just wanted to say something about that. It seems to me some of the more active people we've seen on the research side anyway are emergency department physicians. And emergency rooms have statistics on gunshot wounds, knife wounds, how their admissions escalate towards the weekend. And right, so it's, I don't think you need to, I think the healthcare system does have some data that they could go with. And I wish Steve Hargarten were here, the co-chair of the forum, as an emergency room physician. So I think some of that already exists, and it's just a matter of getting people to talk to each other and getting the information to the right people.
Yeah, we have, to that point,
The people is what I meant.
yeah, to that point, we do the tracking through our system through the codes, through the ICD-9 and now through the ICD-10 codes. And there's, magnitude of codes. Trying to unpack them sometimes and really understand what it means is a little more challenging. But some of those codes are there, but they're very hospital-based. So you're right, you have to come into the ER or you have to be admitted to the hospital, which we see as maybe a small glimpse of what community violence is about, but it is some sort of proxy.
Please.
I just wanted to second that. I work in primary care, and the same issues around coding and how do we extract those kinds of data on an outpatient ambulatory level is perhaps even more complex there, where you're dealing with other perhaps more mundane kind of things as well. So, but I do think that healthcare systems have to be engaged in the process, or we'll never know what we're, looking at, or what solutions can be there.
I think once you have the right people at the table, and once you're engaging some of the key people, use the data that you have, and the data gets better. I mean, it's amazing how it works. And what we were lucky, and this is really how I first met Jim Mercy, and that was we used a system that's related to ICD, which is called the International statistics for external cause of injury. So who, where, why, what, and when. And because we did the where, we were able to do the geographic mapping, which allows for the hotspots, not just of the murders, but of the violence-related injuries in the hospital. So we can, right now, for most of Jamaica, actually identify where the cases that don't result in a homicide exist. Then you overlap that with the cases, with the murders. And then you use that with the community assets. So we do know where the bars are. We do know where the derelict buildings are. The issue is now, how do you get development money, and how do you get government money and business, private-public partnerships to understand how they can use that data and use it in a way that works, not just giving police more guns and more cars, but using it more for the overall development of the community, where you're targeting the most vulnerable and protecting the most vulnerable.
I think the state of the art here is blended data, data that comes from law enforcement, public health, other sources, and in the U.S. that's very difficult to fully realize because of all the HIPAA and FERPA and other legal restrictions on sharing data. But far too many people simply throw up their hands and say it's too difficult. But there are examples of agencies sharing information and doing quite powerful things. Andy Wong, who's a sort of a consultant and a vendor on the West Coast, has created an algorithm where if he gets the data from multiple systems, he can predict that a youth is likely to offend violently within 6 months. And basically what happens is if a youth hits family court, the juvenile justice system, and is expelled from school, all within a short period of time, the chances are extremely likely that very shortly they will be involved in the formal criminal justice system. And basically why that's so important is because for prevention purposes, you get a window to work intensively with someone to head them off from a potential catastrophe. And I think it's extremely important because, Shelley, you said, billions of dollars later, millions of people staffing all of this. Why haven't we done more? I mean, for one thing, we have half the violence we did in the United States than we did in 1992. Violence is declining everywhere in the world except for Latin America, so some good things are happening. But, I think that, my sort of fundamental takeaway on community violence is you don't actually need a ton of money, and you actually don't need a revolution in terms of legislative reform. You don't need to ban all alcohol. You don't need to ban all guns. Although we may support that for other broader reasons, particularly with suicides and those types of things. But I think for people, organizations like Cure Violence that have this very targeted approach, and say, we can make big reductions on this right now in this current political and budgetary environment. Why don't we do it? And I think the issue is not the size of the agencies or the budgets; it's their agility. It's how nimble they are, and can they identify and engage the highest risk people, places, and behaviors.
I can see the problem, though, with an individual and putting them into a model and having to share the data in order to know that this individual is at extremely high risk for being involved in violence. Certainly at the aggregate level, you don't have to worry about HIPAA. I mean, as long as you're not sharing individual data on a particular patient, you're okay with sharing data from the hospital intake about how many gunshot wounds you've treated and that kind of thing. So I think HIPAA can get in the way of some things, but not others. And I think that I get a little worried about sharing that much individual data on a person. But for something like the alcohol issue, city councils already have the power to limit the licenses. They can do that tomorrow. I mean, and we still don't see that happening enough. That won't cost anything except a vote by the city council and the revenue you might get from, the sales taxes. But you just make sure that you're not saying no alcohol outlets will be allowed. You're just saying they have to be spread out to a certain
Or change their hours.
point. Or well, changing hours is important too. Yeah.
So where are we going to go with this? What would you like to see the forum do? What would you like to see the academies do? Your thoughts? Or anything else you want to bring up?
I did want to say, I think that, we've reached a clear conclusion that this isn't an issue that you can only rely on law enforcement to address. And I think that actually Thomas's example of saying, okay, if a kid hits family court, juvenile justice and school expulsion, then they're very, very high risk of getting to violent behavior. But I think that looking at that timeline is incredibly important, because that means, one, what about the kids who don't report to juvenile justice because they either don't have an adult who's going to report it for them, they don't know the systems for reporting if they are in having abuse within the home. How does it get to that point? I think we're missing a lot of these kids where, yes, that's a really good indicator for a kid who is still in school, living with their family, and has someone either within their family or within their near community that's going to report on any familial abuse. But again, that's not necessarily going to be the case with the most vulnerable and most at-risk population for committing acts of violence. Another issue that I wanted to raise is that I think that a very important thing for approaching community prevention and community violence is that we look a lot to really political actors. And that's part of the reason I think that there is so much failure among multi-sectoral task forces and things like that, is that they come in with a political mandate. Their mandate is, I'm going to bring down crime. And then you run into the issue, one, if crime goes up, God forbid, they lose their mandate, even if it's something that's outside of the task force's control. But then if it goes down, you lose the interest. So when you look at communities that aren't violent, they don't necessarily have a violence prevention community task force. There are other mechanisms that are catching people way before they get to that point. They're not necessarily sharing data, and between all of these different sectors, all of those things don't exist. So I think that there is value in looking at those communities that are resilient to violence and saying, what's happening here that's not happening in these other communities? Is it mandatory reporting is actually being invoked for potential child abuse? Is it enrollment rates of school-aged children? Is it all of these other things that are way before you get into the justice sector? And I think that that's really important to say, because I don't think it's surprising when a politically mandated community task force falls apart. Every politically mandated task force on anything falls apart. Like, that's what they're meant to do. They're supposed to be temporary units that kind of come in to solve a problem and then go away. It's a question of how do you build that institutionality. And working in citizen security in general, I think you see this issue a lot where there's the assumption that things aren't political and they're seen as good by everyone, and so therefore they should not be an issue. And you see that a lot with trying to promote crime observatories, in that you have a lot of issue, talking about coding. How do you code at hospitals? How do you do this? Well, getting people to code homicides correctly or to code violence correctly is incredibly political. It's incredibly political and hard to do. So even if you have a very capable, well-funded workforce, there's still a lot of mistakes that go into the data. So I think that saying we have to have good data first before we can do anything is really dangerous. I think that you're not going to get good data until you have more community consensus, and that happens not by approaching the political high level, but by trying to build those resilience factors at the community level first, so that then you can go to the policymaker and say, hey, we know that violent incidents are centered around this building or this neighborhood and this liquor store, and we know that X number of kids in this neighborhood aren't going to school when they should be going to school because we went to the school and asked for their, school days attended. So we know this. So we know these are our hot spots, even if we don't have that sort of overall data that then can say, look, you need to get more kids in school. You need to make sure that more people are getting preventive treatment in these specific areas, and not come down from the other way, but to come to policymakers with a strong case of, we've identified our hotspots, but that's working very closely at the community level, which I think is hard to do when you're outsiders. It's how do you train community workers and work with community workers to do that?
So we're going to report out after lunch.
One of the things, though, I think one or two things is that people want to have wins, and you can have wins in the community at different points. So you know that you get your greatest benefit by investing in younger children. So what do you do with your early childhood population? As much as in many countries, school attendance is variable, at least at the primary level. I just came from a big meeting in Peru where the development matrix network was looking at how much school enrollment has increased worldwide. But what they pointed out was that while the quantity has increased, the quality hasn't increased. And what was also very interesting was that they weren't only talking about academic quality, they were also talking about behavioral quality. The attitude of students being employable and being able to work together without conflict and things like that. So at the education level, there's a big chance to, if we can retain our guys, especially in school, and if it's a problem with girls, especially preventing teenage pregnancy, which causes a huge dropout rate in girls. While they're in that education phase, there's a big captive audience there. And Shelley, you were talking about school resource officers, but where I've seen them, and I don't know, I suppose they've been very much enforcement of expulsion rather than, bringing together, working with social services, doing home visiting, reuniting families, and making sure they get services. And the other side of it is at another level, when within the community, that when they leave school, that there's something profitable for them to do. And I think with the sustainable development goals, all of these areas have key sustainable goals, areas that are there, and we have to make them work together. But on a programmatic side, what is very important with any of these wins is maintenance. And this is where I think we fail. And I think Cure Violence has seen it, peace management in Jamaica, if we get moved from an area where you have success to another area that becomes a hotspot and there is no maintenance program, you can discredit the whole value of your program. What peace management does in Jamaica is establish within community sort of liaison officers. They're like the early warning signals, like in medicine, we have these early warning, things. And they activate a response to re-intervene at a high of the interventions, to up the intensity of the interventions. But you have to realize that once you succeed with a community and you've reduced the level, one of the most important things is that maintenance process. Because if you give up on it, it's going to go back. And I think that's what the US is facing right now, that you kind of got a complacency that the homicide rates were down. And maybe we weren't looking for some of the signals, the early warning signals. And we're not that far along the way, but I think there's real need to step up this process, especially at a community level, to make a sustained, meaningful impact and to get the buy-in.
To with consideration of the fact that we just have a few minutes left, and thank you for volunteering to report out. There's a note taker behind you, right behind you. What are the 3 things or 4 things or 5 things we want to convey to the total group when we reconvene? Your thoughts? Tom?
Do we have to answer those questions?
Well, sort of, but yeah, and I mean, we don't have to, we didn't talk specifically about mental illness or spend a lot of time talking about resiliency. I think the term came up one time. But I think what we talked about was very important in guiding the future of the forum and some of the issues we can take on. And that's the context of the reporting out. You know, what do we do with what we just talked about?
The fact that there are communities where you don't have as much violence, and so that, to me, is a resilient community.
Tom? I'm sorry.
Addressing violence in a community requires a community response, that it's not a single sector, it's a multi-sector, multi-perspective organizations, individuals, as we mentioned, that is the response. It is not law enforcement or any other single entity group.
I'm very, come at this stuff very pragmatically. I've spent most of my time working in government. So if we're talking about making a immediate difference in the short and middle term, it's about identifying the people, places, and behaviors that are most at risk and targeting your resources to that. If you're spending a lot of prevention dollars on people who are low risk, that's probably good for development purposes. It's not good for violence purposes. If you're spending a lot of money developing poor neighborhoods but not paying attention to their hotspots and expecting a decrease in violence, not likely to happen. If you're not focused on those key behaviors that we talked about, liquor, firearms, and those things, and not all of them, but in the hands of the riskiest people in the riskiest places, then you are, then I don't think you're going to have a significant short or middle term impact. And I think one of the questions for the forum is this organizations that's interested in short and middle term impacts, or is it more of a sort of advocacy based long term approach? Because obviously, in terms of addressing all of the root causes and structural factors, that's extremely important. But I think that if that is the only focus, the structural factors working from the outside in, then you're really only talking about a long-term solution, not a short and middle term.
And just to add to that, I would say that if we don't focus on the short and middle term outcomes, I don't know that we can get to long-term outcomes when it comes to violence. Because when violence is present, it makes it borderline impossible to talk about improving school, because if you are afraid to go to school every day, or if you're being bullied in school, or if there's violence within the home and that they're missing school because of that, or when we talk about poverty and businesses don't want to move into an area where violence is present. So really thinking about and pushing to think differently about what prevention really is. And in this case, it might be not the traditional primary prevention that we talk about in terms of public health, but instead how preventing immediate acts of violence ends up moving into that long-term, more secondary and tertiary aspects of it all.
Yeah, if I could just reinforce that, I think many of us in progressive circles and in the prevention community and the academic community are very comfortable and understand deeply the connection between structural factors and root causes, inequality, joblessness, lack of opportunity, systemic racism, all of those things. But we have a weakness in that we generally only look at those relationships in one direction. We only look at structural factors and root causes as causing high rates of crime and violence. We don't look at it in reverse. And that's one of the things that's very exciting about the SDGs, is that's beginning to reverse that process. And I would argue that by going to the heart of the problem in terms of violence, you may be able to unlock enormous potential on those root causes. And so if you decrease violence, you increase investment, you decrease inequality, you may even remedy some forms of racial fear and resentment. And so I think there's real power in thinking about these connections, these relationships in both directions.
Any other comments before we close for lunch?
In that situation
Make the,
that Tom is talking about and we're talking about, how would the police feel? Because often I find that the police get very upset if they are not in control. And it often seems that they are, they want to lead all the interventions in the community. They want to lead all the football games in the schools and the dropout programs. And
go ahead, Tom.
I mean, so I helped coordinate a coalition of 15 cities with multidisciplinary partnerships, and I have to say, in the U.S., and I think we all got to look in the mirror here, the public health community is at least as hostile to law enforcement as law enforcement is to the public health community, and so I don't think that may not necessarily be true in Jamaica or in certain places in Latin America, but we have to think about being good partners too. And when law enforcement and suppression is conspicuously absent of every public health discussion in violence, you're missing a huge part of the solution. Only part, and maybe not the leading part, but they've got to be at the table, and we've got to be comfortable with that, just like they have to be comfortable with us at the table. We train them and they train us. We do it together.
Yes, and we actually have a lot on that, and I can share that with you during lunch or after. Thank you, folks, very much. I mean, we had a very short period of time to deal with a little bit of complexity, and I think you did a great job to get the dialogue started, and that's really what we're doing. It's just getting some direction going. But thank you very much, and let's keep the dialogue going.